Good morning, everyone. Like Jessica and Ruth mentioned, I am Madison Gaskill, the Program Coordinator for the Ohio Program for Campus Safety and Mental Health. And it is my privilege to introduce our morning keynote speaker, Dr. Swanbrow Becker. Dr. Swanbrow Becker is an Associate Professor of Psychological and Counseling Services in the Educational Psychology and Learning Systems Department at Florida State University. He has shown a strong commitment to improving people's lives through designing effective mental health prevention efforts. And at Florida State, he has integrated his research, teaching, and service to further his study of college student mental health and his efforts to improve suicide prevention and wellness promotion programs. We are certainly excited to hear more about his research, so please join me in welcoming Dr. Swanbrow Becker.
Well, thank you all so much for having me here. I'm Marty Swanbrow Becker, and actually I used to work and live in Akron, Ohio, so it feels like I'm coming home. It's been maybe 20 years, but it feels good to be back here. Today, we're going to keep going on this theme of collaboration and a caring campus. My time in Ohio actually set me up to think about my career and my life and what I wanted to do with it. And where I found myself was a strong passion for helping youth overcome mental health issues. It started when I worked in a psychiatric hospital in Baltimore. And what I found was that I loved working with people in crisis. They were young men and women. It felt good. I was pretty good at it. I was able to stabilize them and send them home. But what I quickly learned was they kept coming back a month later, sometimes a week later. And when I thought we had healed them and cured them, I realized that we hadn't really done that. We had stabilized them, but then sent them back into the very environment that had sort of precipitated the problems. And it was there that I grew a passion for prevention and wellness promotion and trying to find ways that we might help people not become suicidal, not progress along a sort of continuum of distress. So I'm here to talk a little bit about that journey and how I've helped Florida State and other universities create collaborative campuses. Some learning objectives. So we are going to help you appraise your climate and culture and think about strategies to develop suicide prevention and wellness promotion. We're going to also talk about it from a research perspective. So some of what I learned was we had great ideas at Florida State for implementing suicide prevention, but we didn't know if they were actually working. People would come out of our trainings and say, that was a great training. We're going to give you a 5 out of 5 on how good that training was. But did they actually go out and talk to more people with the question, persuade and refer model that was mentioned? Did they go question someone? Did they persuade them to get help? Did they refer them to help? We didn't really know that. So we'll talk about the research we conducted to try to figure that out. And then hopefully you will have some ideas about how to design your programs and your campuses to create collaboration. The first thing I'm going to do is a little activity to help think about the paradigm that we're in with suicide prevention. So imagine, maybe not in the far distant future, we have the technology to look at a map of our campus and see through light how people's mental health is. So those who are lit up white on this digital map are not thinking about suicide. Those lit up red are thinking about it, and those lit up green are the helpers. Those would be people like us. And what we're going to do is condense this into a year's worth of sort of progression around the campus into 24 hours. So we can sort of see, fast forward, how these lights shift around campus. The white lights of the healthy students, mentally healthy students going around, the red lights of those thinking about suicide, and the green lights of the helpers. So the first thing that we might notice is that the green light people, the helpers, tend to be drawn to those who are bright red. We tend to be drawn to those in suicidal crisis who are displaying high levels of distress. And we do that so much that we don't always notice that there are some white lights that are flickering red. There's a little bit of red there, and then they kind of go back to white. And we're we're so focused often on those in distress and in crisis that we don't pay attention to those. Sometimes they flicker for a very brief period and they go away. Sometimes they look white because they want us to think that they are not thinking about suicide, and they hide it from us. So it takes a lot to actually notice it. Something else that you notice about the green light people is we sometimes cluster together in places like counseling centers or in our offices, and we wait for those red light people to come to us. We wait for them to find us. Some of them find us, many of them don't. The other thing that we see is that the green light people, the helpers, in some sense try to attract as many of those red light students as we can. We try to bring in as many of the suicidal students as we can, but then we get overwhelmed because too many come in. We do things like try to connect with them over telehealth or other ways, and that sometimes helps. But what we notice is that when they come into our counseling center, we often do help them. We turn them the red light to white, and then we release them back. But we don't always know, do they turn back to red later? The other thing that we notice is sometimes we find students who are in so much distress, we send them to we'll call it a repair shop or a hospital. We make them go to turn their light to white, and maybe that works, maybe it doesn't. But after that, they really don't want to talk to any of the green light people again. Once we force them into that, maybe that helped for a moment, but then they don't want to come back. And in fact, research shows that forcibly requiring people to receive mental health treatment those who are forced to receive it tend to have higher rates of suicide down the line compared to those who weren't forced and were entered in a more collaborative way. The other thing we notice is that while we were able to turn some red lights to white, over time more red lights pop up, and we aren't really adjusting the level of distress on campus. We might be impacting some people, but we're not really fixing the problem or securing the problem. So as part of that, as a sort of introduction to the talk, thinking about how are students moving around campus, are we noticing who's in distress or not, and what are we doing as helpers? Many of the students in distress would rather talk to their friends and peers. Our research shows that when you ask students, who are you most comfortable talking to about your suicidal thoughts, the answer is overwhelmingly my peers, my friends. Sort of next is friends and family. Way down the line are people like professors and other helpers at the university. So wanting to switch some of that. All right. So we're going to talk a little bit about the challenges of suicide and mental health distress on campus, expectations and challenges. I should have this slide here so I'm not turning around. Expectations and challenges of our counseling centers and how they might work more effectively and efficiently. Collaborative suicide prevention on campus, and I'll tell you about Florida State University and how I came to a not very collaborative place and sought to make it more collaborative. And then we're going to pivot to mental health promotion and some next steps on what you can do. All right. I know you all are aware that suicidal distress and distress in general is a big problem on campus. But I like this data that we collected in one of our studies. If you ask people, some of the early studies with suicide prevention asked, have you seriously considered suicide in the past year? And generally about 6% of students would say yes to that. And so that was kind of the answer. About 6% of students are suicidal. We ran a study where we asked a more nuanced question. And this was sent out to about 25,000 students across the country. It's about 70 different universities, so a pretty big sample. And what we found is if you ask the questions in different ways, more nuanced, you find that it's not either or they're suicidal or they're not, but that it does seem to look like a continuum. You have sort of pre-suicidal thoughts. This is all just too much. I kind of can't deal with it. Almost half of students experience that. I wish this would all just end. 31% getting closer to that sort of suicidal thinking. I have to escape. And then where I wish I was dead, I want to kill myself. That 6% seems to be in between there. older studies that said, have you seriously considered suicide? Students seem to be endorsing something between, I want to kill myself and I wish I was dead. I might kill myself, I will kill myself. So you see the numbers go down. And 40% said, I didn't have any of those thoughts. So we really want to be getting those students up closer to the top, up at the front. The National College Health Assessment, also a national survey that went out a couple years ago, measured a lot of things, but these are a couple of stats that caught my eye. One is loneliness. 52% of students said they were either somewhat or very lonely on campus. That feels like a big number, especially when we think about, when you think about someone that you're working with in distress, and what you're most worried about, what I worry about is, are they connected? Are they connected to other people? Are they connected to their future? Are they connected to their institution and their plans? When students aren't connected to anything, I get really worried about that. If they're having thoughts of suicide, but they say, well, I've got my pet, or I'm connected to my religion, or my family, I feel better letting them leave my office, and I know, but I feel more confident that they'll be back next week to continue the work. When they're not connected, I get really nervous about that. So seeing that high stat really stood out to me. We're a campus where we look out for each other. So thinking about whose job is it to engage in suicide prevention on campus? Well, it's certainly our job to create the structure. But if we just come from a top-down approach and say, here's what we're going to do, here's the programs, we miss the energy and the creativity of the students who are actually living in that world. And I think thinking about the mission that you want to have and having that transfer down to the students can be really helpful. I would want to go to a campus where everyone looked out for each other, not a campus where half of the people looked out for each other. Feeling safe at night, only 28% of students, and this was, again, a national survey, felt safe at night on campus. So there are things that we can do in the environment, things like reducing discrimination, helping people feel safer, providing resources. So there are a number of different areas that we can intervene. Moderate to serious psychological distress, 75% of students said that they were experiencing that. That's a lot of students. Intentional self-injury, this struck me. 11% of students said they engaged in intentional self-injury. But if you were trans or gender nonconforming, that popped up to 31%. So understanding that not all students are the same, and that there are certain students with certain identities that make them more vulnerable. Prevalence of distress. So some of these are things that I think we can intervene with as staff and administrators on campus. Having microaggressions, 17% of students experience that on campus. That's a lot of students that are experiencing microaggressions. A lot of students might not even know what microaggressions are. So part of our role might be educating and training about, hey, we need to raise our awareness of what we say and what we do and how that actually impacts people. Reducing discrimination over discrimination and more subtle forms. Sexual harassment, 11% is still happening on campus. Verbal threats are high. Bullying certainly is high. And those who drink said they later regretted something. So it might be a tall order to eliminate drinking among college students. I don't know if that's a feasible goal, but understanding that there are safer ways to do it that are maybe a compromise. The university certainly wouldn't endorse underage drinking, but also recognizing if it's going to happen, we need to help students be safe about it. Don't go to a bar without a friend. Don't go to a party without a friend. Always have someone looking out for you. Some of the bigger sets, I think you all know a bit about this, so I'm going to go over this more quickly. 68% of students felt isolated. This was 22, 23, so this was just last year, really. Anxiety is high, depression is high. non-suicidal self-injury, 29% of students engaging in non-suicidal self-injury, almost a third of students. So the distress is really high. Suicidal ideation. One of the things I found in working with administrators on campus, for instance, I work a lot with our dean of students at Florida State, and they certainly care about mental health, of course, but the thing that gets their attention is when we say, well, mental health is impacting their academics. It's going to cause people to leave campus. It's going to cause grades to go down. They're not going to be able to perform. And somehow that triggers a reality. They certainly care about mental health, but this makes it real, like, oh, academics, right? And so I think one of the things that is helpful on campus is to understand your audience and what they are responsible for in terms of their metrics and helping to tie mental health to that. And certainly still a lot of stigma on campus, and a lot of people getting therapy and a lot of people getting medications also, so campuses needing to be accounting for that. At Florida State, we have been looking more and more about connection and belonging. One of the things that we found was that, and I'll talk about it in a moment, but we have created suicide prevention trainings, we've revised those trainings, and it's hard to get students to intervene with each other, we find. When you actually ask, how often did you intervene? If you ask how comfortable you are to intervene, they'll generally say, I'm pretty comfortable, especially following the training. But if you go 3 months later and say, did you do it? It's really hard to get them to do it. And we'll talk a little bit about why that is in a moment. But what that led us to think about is there a precursor to suicide prevention training? I mean, it's hard to go up to someone and say, are you thinking about suicide? So what do we need to do to set the stage so that's a more comfortable conversation? If people are more connected with each other, maybe that's going to be an easier conversation. So we'll talk about that in a moment. But as part of us looking at this, we asked students about how many programs you were engaged in, how many activities, close friends, how connected you were generally to the university, and how much you felt like you belonged. And when we looked at across socioeconomic status, we found a couple of things. One, in terms of the number of programs, the students in the lower SES group and the higher SES group tended to be the most engaged. Part of that is at Florida State, we have a program called, we're the Florida State Seminoles, so Knowles is on all of our programs. So our program is called, I can't remember the name of the program, but we go out to high schools around the state and find students from low SES areas, and we recruit them to come to Florida State. And we give a pre-summer primer. They come early, they take classes to get them ready for school. They have a lot of support. So we have a lot of support for students from low socioeconomic status, generally first-generation students coming through the program. That is driving up those program numbers. So at Florida State, we've said, all right, we're going to really focus on this group, and we're going to help them. Those in the top SES, maybe that happens naturally. Their parents help them. The people who get lost are those in the middle, where they're not qualifying or belonging to certain programs, and they're not coming from high SES backgrounds, where their resources are helping them, and they get a little bit lost. So I think that's one thing also to look at, is when we look at one group, are we missing some others? A similar stats with activities, but then it starts to shift. When we ask about their friends, those from the lower socioeconomic status groups, who tend to be first-generation students at Florida State, had less friends, less close friends than those with more resources, and that's not a good thing for mental health. They were also less connected, and they had a lower sense of belonging. So even though we were intervening and getting them involved in programming and activities, it wasn't hitting those other metrics of building friendships, building connection, and building belonging. So the lesson for us is, depending on what you ask, you might find answers to that question, but you have to be very thoughtful about what it is that we're trying to drive here. What we were trying to drive was get them more engaged in programming, but what we really wanted was for them to feel more engaged and connected and belonging, and we didn't get that yet. And I really like these stats. So perceptions differ from reality. So when asked, this was from a national survey, 69% of students said they used alcohol in the last 30 days. The survey also asked, how many students on campus do you think use alcohol in the last 30 days? And the average response was 93. So they're thinking everybody's drinking, and a lot of people were drinking, but not as much as everybody. And the results are a bit more stark when you look at marijuana use. 27% said that they had used marijuana in the last 30 days. Who wants to guess how much of the campus they thought used marijuana? So 75 is close, 80. So they're living in these sort of social bubbles where they think everybody is engaged in these behaviors, and that can drive peer pressure. But in reality, that's not really what's happening. And I think this can help with education and prevention and promotion of mental health by helping students get a better sense of avoiding peer pressure and thinking about what they want to do and how they want to live. For students who don't drink on campus, it can be very difficult. There are not always a lot of programming, not a lot of activities geared for those students. Not like campuses have programming for students consuming alcohol, but at least at Florida State, if it's a tailgate day, if it's a football game, the activities are about a lot of it student drinking. And so some campuses are trying to create more activities for students who don't want to drink and have fun, but then it has to be fun. Do I want to go to this counseling center event, or do I want to go to this barbecue with my friends? And so it's hard to make that happen, but I think that's a place we can put some effort to make it more fun. All right, I know it's a little hard to see. I was trying to get a lot on one slide, but this was a study we did, again, a national study, and we asked in the first column the percent of students who endorsed having this stressor across the year, and the second column is the percent of students of a subgroup of those who had seriously considered suicide during the year. So the first column is sort of everybody, and the second column are those who were suicidal. And you'll see in the first column, and it's sort of ranked from most to least, students are worried about their academics, financial problems, romantic relationships, life transitions, all the things you would expect college students would be stressed about. When you ask students who are suicidal what they're stressed about, they sort of start at the bottom. Gender identity, sexual assault, suicide of a close person, relationship violence, sexual orientation concerns, legal problems, trauma, discrimination, drugs and alcohol. So we're seeing that there's this group of students who are suicidal that are experiencing these other issues, and that they really are different than most of the students on campus. And so digging into our data a little bit and being thoughtful about what we're asking can help us understand how are some of these students on our campus really different than other students. Sort of in that theme of a continuum of distress and thinking about our paradigm, when we were doing, so this chart talks about on the left, that's a percent of students who report, this is from the American College Health Association's National College Health Assessment, feeling exhausted but not from physical activity, about 80% feeling sad, a little bit less but still high, feeling that things were hopeless, kind of in the middle, so depressed they couldn't function, seriously consider suicide and attempted suicide. So you can see it's sort of a continuum where students start with some feelings, and then if it doesn't resolve or they can't stay there, it progresses towards attempting suicide. And the whole idea, and thinking about that lights activity that we did at the beginning, how do we reach those students a bit earlier instead of waiting for the suicidal thoughts to occur? Let's get them when they're starting to feel sad or exhausted much earlier. When I arrived at Florida State University, I was so excited to engage in suicide prevention research on campus. That was the research talk I gave when I got my job, and I'm going to come here and do this. And I went to the counseling center, and they were very nice, and they said, well, we used to have suicide prevention training, but I think a couple years ago we got, don't tell the university university I'm saying this because I think this is private, but a couple years ago we got in an argument with university housing, like two people did, and so now we just don't do it anymore. And I was like, so you don't do suicide prevention training because two people got in a fight? Yeah, kind of. So we took a breath and we said, well, how about if has enough time gone by that we might switch that? And they said yes. And so we created a mental health team on campus. And on this, what we found was that we have a lot of clinics. Florida State has about 45 or so thousand students, so we have a lot of resources. That we have a counseling center, our psychology program has a mental health clinic, we have a marriage and family therapy doctoral program and master's training program, and they have a clinic. There's a clinic in my college. I'm in the College of Educational Psychology, College of Education. I'm in Educational Psychology. So we have a clinic. So there were like 4 or 5 clinics on campus. We all didn't really talk with each other very much. There's also a lot of prevention happening. And so we formed a team to pull everyone together to talk about, just to talk really, and think about initiatives that we wanted to engage in. And what we found was that there was a lot of resource happening. People would put out flyers about drinking, being responsible with drinking, or sexual health, or interpersonal or partner violence. And a lot of those messages were going out, but they weren't particularly coordinated. And our clinic wouldn't know there was this initiative going out that might be sending people to our clinic. So it was a way to coordinate a little bit better. And one of the things that we found was that faculty and staff really didn't know anything about mental health. Most faculty and staff didn't want to be engaged in mental health. Or they did, but they were too nervous about it. And so we applied for and got a Garrett Lee Smith suicide prevention grant, which is from SAMHSA. And that grant allowed us to engage in work to get our faculty and staff trained in suicide prevention programming. A couple of things that we did was, I'll talk about the grant in a little bit, but one of the things that we did was figure out where our partners are. And that tended to be, there were a couple colleges that really were sort of lukewarm about it, like, well, okay, I guess we'll do it, but we're not really that interested. But other colleges, there had been students who had died by suicide in those colleges, and the deans of those colleges really wanted it to happen. It really, when there was a death in the college, it really impacted the faculty and staff. One of the things that we also learned was that different people on campus bring different skills, but also have different needs. So for me, as a faculty member or researcher, and I teach, I have a need to have research ideas and a pool of participants, and to understand what's a need, what's an unmet need that I might research to help fix. When I just sit in my office staring at my computer, I don't necessarily know what that is. It's not intuitive to me. But if I go speak with people at the counseling center and they say, oh, well, here's what's happening, or I go speak with professors and they say, well, yeah, students are coming to me saying they're in distress, but I have no idea what to do about it, and I just kind of sit there fidgeting, then I have the ideas. And so you have faculty members on campus with the capability to engage in research, drive these projects, apply for grant funding. They have graduate students who likely want to engage in this work as well, so they have sort of a team of people ready to engage. You also have mental health practitioners who are maybe more aware of what's happening in terms of clinical need on campus. You have people in administration who are seeing sort of shifts. One of the shifts we've seen at Florida State is that it used to be when people would leave the university, they would say, it would be because of bad grades, or they couldn't afford it, there was a financial hit. But more and more we're seeing that students are saying on their exit interviews, I just feel like I didn't belong here. I just felt like it wasn't the right place for me. And so I would know that as a researcher. So by collaborating with those out in the field, we learned that. There are students who have a lot of energy on campus. At Florida State, we have two mental health groups. We have NAMI and Active Minds. So I'm the faculty advisor for Active Minds, and it's great. It gets me out into the field. I'm meeting with students. It gives me a reason to go to the counseling center and say, hey, I'm the faculty advisor for Active Minds, and we want this to happen. Where without that sort of pool of students, it's hard to do that, or harder to do that. So when we were designing our suicide prevention trainings, one of the first thoughts that we had was, well, what is it that's not working? Why is it that students aren't just coming to the counseling center or disclosing their thoughts? We did a lot of work with resident assistants to try to train them on suicide prevention. Our research had suggested that, not just ours, but all research is suggesting students are much more comfortable approaching peers for help than others. And so resident assistants are kind of quasi-peers. They live with the students. They're in that environment. So trying to train them. And when we asked about what their barriers are, we found sort of this list. It was a qualitative study that we ran. And so a lot of students say, well, I didn't tell anyone about my suicidal thoughts because I just didn't think there was a risk. I wasn't going to do it. I wasn't actually going to follow through with it. It was just something I was thinking about. And so that leaves me thinking like, okay, that's good. You're not going to act on those thoughts, but you're still walking around the world thinking about it rather than thinking about, math or English or whatever it is that you're studying. So part of that helped us formulate our training, where in the training we talk about, even though you might not actually think you're going to follow through with it, the counseling center, professional help really can help you adjust those thoughts and let go of those thoughts and see the world in a different way. One thing that we know about counseling centers is they are pretty good overall at helping students address their thoughts of suicide. Other students said, and these are in order of sort of most to least, other students said, well, I don't want to burden someone else. I don't want to make my problem someone else's problem. So then part of our training becomes, for those who are engaging in this work, for instance, a QPR kind of model where you're going to talk to someone, it's important to express, you're not a burden to me. I want to help you. This is something I want to be doing, and you're not taking up my time. We're good. A sense of privacy. Some students felt that it was a private thing just for them. And that's a hard one to address. One way that we can address that is to remind students about confidentiality and anonymity of resources. So if they go to the counseling center, that's confidential. They could call a helpline and be both confidential and anonymous. You can call anytime, anywhere, and you don't even have to give them your name. You can just talk to someone. So having the people we train understand that these are things that you might face, these are things students might say as reasons they don't want to get help, and being able to give them that sort of quick answer of, here's how to respond if they say that. Some said that it was pointless. Well, it's sort of their depression. Maybe talking, I could go, but it's not going to help. It's not going to fix anything. So helping them understand, well, actually, counseling centers are really effective in helping students address mental health issues. There's the stigma. What if people find out about it? I was at a university consulting with their mental health, and they said that athletes really didn't want to go for help because people would see them walk into the counseling center, and then everyone would know this star athlete or any athlete was getting help. So we found ways to have them go kind of through another building and through different ways so they didn't have to go there, or bringing the resources to them. We can, I think it is Cornell University implemented a program where their counselors actually go to different places on campus a couple days a week and sit there and maybe have satellite offices. Some shame about it, that they feel bad about themselves, so that would be important to get them into counseling to talk through that. Some were worried about repercussions. Am I going to get kicked out of school or in trouble if I have these thoughts of suicide or mental health distress? So making clear university policy that that's not a reason that you would have repercussions. It would be more focused on behaviors. The scariest group for me was those who said, well, I don't want to be interfered with. If I tell someone about my thoughts, they might try to stop me. And that's a scary group and a rough group to get to. And that's where it's important to have campus safety officers be trained in mental health intervention. And we have that, many campuses have that. We have that at Florida State, where we have all the officers are trained, but there's a particular group that tend to go out and do wellness checks of students. And so that might be an example where if someone were worried, they could send them to for a wellness check. And then some said I didn't have anyone to talk to. I didn't know where to turn or who to talk to. And so making sure students know about that. How to get people to show up when I would do suicide, when I would engage in suicide prevention training. If I said, hey, campus, there's going to be a suicide prevention training today, I'd get 1 or 2 people. If I said, hey, campus, there's going to be a suicide prevention training, and I've got pizza and drinks, I get 10 people. But if I went to a sorority or a fraternity and talked to the leader and said, hey, how about if we train you all on this? Is that something you want? And they say, yeah, I get 50 people, easy. So some of that learning about, it's about getting the students to motivate each other. The other piece was when we were training faculty and staff, going to the deans and the chairs of departments and getting endorsement from them. If they tell the faculty we're doing this, then that's easier. If I said, hey faculty, we're doing a suicide prevention training and there's pizza, I'm still not going to get anybody. All right, so we were wondering, sort of going back to a little bit earlier, we were wondering about whether our suicide prevention training was effective. So we were training resident assistants at Florida State to intervene with students, notice when they're in distress and when to intervene, what to do, what to say, where to send them. They were leaving the meeting saying, great training, I know what to do, I'm great. And then 3 months later we asked, okay, so what'd you do? And we had 2 groups. We had one group where we trained in suicide prevention training, and then another group that just got mindfulness training. And these are resident assistants at Florida State, and we trained them by the residence hall. So all the RAs in one hall were in the same group. And at the end of about 3 months, we did that at the beginning of the fall semester. At the end of the fall semester, we surveyed them, and no difference. Those who were in the training did not intervene any more than those who were in the other group. Part of that is sometimes our suicide prevention trainings, especially on campus, can happen during orientation, which is when this was. And so they're getting 60 hours or so of orientation, and this was 1 hour kind of crammed in there. And so, yeah, they said it was a great training, but right over their head. And then it's not always the kind of thing that they're intervening with all the time, every day. So our thoughts were maybe we needed booster sessions or trainings. And so we did then revise the training. We would do, the next year we had the training, and then we would meet with RAs as groups after about a month or 2 to hear, okay, how's it going? Tell us about students who are in distress and your attempts to talk to them about their thoughts and what came in your way. And we would hear stories like one student said, well, a student came up to me in distress, but I was rushing to an exam, and so I had to decide, do I talk to the student or be late for my exam, and I didn't know what to do. And, we wouldn't have thought that was something that was going to happen, but talking to them and asking how is it going allowed us to work with them to intervene. Another interesting thing happened. So when we sent out a survey, there was no difference between those groups, but we also had focus groups where we got 6 to 8 students who were trained in suicide prevention, 6 to 8 who weren't, and we asked them, how did it go? Those who weren't trained were saying things like, I don't think you can or even should intervene with students who are suicidal. I think if they want to do it, that's kind of up to them, and there's nothing we can do about it. And those who got trained in suicide prevention said, oh, it's been great. I knew what to do. I noticed my students. I would talk to them. I think we should have more trainings like this. So what that taught me was when we evaluate our programs, it's really important to think about how you're doing the evaluation. If you ask certain questions, they may answer in a way that you're not expecting. So we mixed it up. We asked quantitative questions on the survey, but we also met with the students and asked them about their experiences. And through actually talking with them and asking, we got a much richer sense of what happened. Also thinking about the impact of social connection. So at Florida State University and in many universities, we have what are called living learning communities, where students are in university housing with resident assistants, and all the students in that group are in the same major. So they live together and they learn together. There's a faculty advisor who comes and speaks with them. And we looked at whether suicide prevention training for that group was different than suicide prevention for the general university housing, and it was different. Students in that group, the more connected living learning community, much more likely to say, I would talk to a peer, much more likely to say, I would speak with a professor, much more likely to say, I would go get help for my thoughts, as compared to students who are just in regular housing. And so that gets back to one of the initial questions we said, which is, we can do this training, but how do we know if it's effective? And some of that, I think, is setting up the stage where there's a sense of connection among the participants, where they are already connected, and then overlay training. And it could be suicide prevention training, or it could be alcohol use training, it could be any of them. But I think if we want people to intervene, we have to help them feel connected to someone, or else it's too hard and maybe too awkward to have that. So training of our faculty and staff. Oh, I wish I made that a little bigger. So this was our SAMHSA grant where we went and trained faculty and staff on campus. Our first goal was to assess the needs of faculty, staff, and students. What's their desire to implement suicide prevention in their areas, and how do they want to receive suicide prevention training? Then we wanted to increase the percentage of faculty and staff who felt competent in handling students, handling their mental health concerns. We wanted to increase the sense among student leaders of their competency in handling mental health concerns. And then we wanted to increase the perceived efficacy and comfort of students with talking to faculty and peers. When we would ask students, who would you turn to help, faculty were always at the bottom. And so we wanted to try to raise that up a little bit. And then we wanted to utilize a multidisciplinary leadership network to integrate suicide prevention training across campus. So through these goals, we learned a couple things. One, hard to get faculty trained on anything. And at Florida State, we are unionized, so you can't make us do it either. So you kind of have to get us to want to do it. So what we found was that they weren't going to sit through an hour training. They were doing the research. There's a lot of pressure they're busy. And so we came up with a model where we developed a 15-minute training that's, get into a faculty meeting. They have faculty meetings, once a month or so. They also have their college or departments tend to have meetings at the beginnings of semesters. And so 15 minutes allowed us to get in there. And it was tough because we were thinking, well, we can't convey all of this in 15 minutes. But then on the other side is, well, 15 minutes is what we have. So let's try to do what we can. And so we created this really sort of short and tight presentation, talked briefly about the prevalence of distress on campus, what to look for, quick sort of what to say, and here are some of those barriers that students might say. You might notice it in what they write, you might notice it in their behaviors, you might notice it in their grades, and then here's what to do about it. Talk to the student, ask them how they're doing. Here are some resources on campus to refer them to. And we got it done. We also had a 1-hour training where each college or department could assign one or two people who are central people. I know in my department we have an administrative person who knows everything about everything, and it's who we all go to if we need help. So he was very interested and had the capacity to get trained. So we found those sort of hubs around. In the end, we trained about 1,500 faculty members across campus, so we got a lot of them trained. There were some colleges that were really into it, mostly the colleges where there had been a death of a student. Unfortunately, that's sort of what drove some of this. The trainings were effective. The faculty members reported feeling much more confident and comfortable intervening with students. We weren't able to take it to the point of following up later, how many did you actually intervene with, but their sort of pre-training to post-training surveying suggested they felt much more comfortable, much more relaxed, and knew what to do. Some special student populations. Our research shows that those LGBT students are having much higher rates of suicidal thoughts, suicide attempts. They're also much more likely to have experienced trauma in their life. They're more likely to go to counseling and have a counselor. So sometimes you'll see statistics that show that they're in counseling more for a crisis, but often they're already in counseling when a crisis happens, and so that's why sometimes they might be going to counseling more in a crisis, more ready to go because they already have that relationship. International students can feel so lost on campus. They feel, what we feel is just policy, they feel is discrimination and a lack of caring about their needs. Student athletes are also a population that can be difficult. First generation and culturally diverse students, I'll show you some stats on that in a moment. At FSU, we focus a lot on transfer students. They missed all of that initial orientation of getting on campus. And so how do we help them attach when they're coming in maybe as juniors or sophomores and they miss the whole freshman year? It can be hard to integrate at that point. All right, thinking time, good on time. We have till 10. Okay. So I'm from Florida, and I don't know if you all have been watching the news about our governor preventing us really from engaging in diversity, equity, and inclusion initiatives. That's had a significant impact at Florida State University. We've literally closed offices. Faculty members are scared we don't know if we're going to be fired for doing research in these areas or teaching models of cultural diversity and gender differences. So it really has had a chilling effect on campus. Just this last summer, we ran a survey among our students to try to get a sense of how that might be impacting them. So one of the questions we asked was, how much do you feel the university supports diverse students? And then we also asked them about how likely you would be to get help and how likely would you be to offer help. And so these slides are a little bit rough because they are just coming from our statisticians, so I decided not to fancy them up. So here's the first one. So on the bottom is university support of diverse students. So that's how much the students felt Florida State University supports diverse students. To the left is I strongly disagree that they support diverse students, and to the right is strongly agree. The red line are the heterosexual men, the blue line heterosexual women, and the green are LGBTQ or non-binary students. So you'll see that among women and the LGBTQ community, they're a bit resistant to how much the university supports diverse students. They are above 3, so 3 was sort of neither likely nor unlikely. The question was how responsible do you feel for your peers? So if someone is in mental health distress, how responsible do you feel that you should intervene with them? So that was the question. So the women in the LGBTQ population said, well, I feel pretty responsible, 3.5 on a 5-point scale for other people. And it doesn't matter what the university says, I feel that way. Heterosexual men, though, if they felt the university didn't support diverse students, they also didn't feel responsible to look out for their peers or turn to someone else. Maybe an attitude of, well, no one cares about me or others, so I don't care either. as they began to feel more of that support, that the university does support students, they start to look more like the heterosexual women and the LGBTQ population, more willing to feel responsible for others. It's hard to know exactly what's causing all this. Some might be a sense that women in the LGBTQ population, at least on our campus, have maybe felt that they're not that supported anyway, and so this is not, we think this is something new, but they're like, this isn't new, this is just kind of more of the same. Perhaps they're resistant that way, and the men are maybe waking up a little bit to see what's happening, perhaps. So that was interesting and a real impact. So that when the university engages in this kind of work around quieting diversity, equity, and inclusion, and reducing people's sense of feeling that they're supported or belong, that might relate to their reaching out and helping others. Looking at racial differences, so that we asked a lot of nuanced questions about racial identity, but for the purpose of this, we grouped the white students and the non-white students. The white students, this is again feeling responsible for peers, felt pretty responsible, and it didn't matter what the university, how much they felt the university supported diverse students or not, they were pretty resistant to that. The non-white students, though, a big difference, almost a 1-point jump on a 5-point scale. So it's 20%. I can't do that math so fast. I think it's like a 20% increase. So students, the non-white students who felt the university did not support students from different backgrounds also were much less willing to feel responsible for others. But as they felt that they were in a place where the university does support diversity and maybe others that as part of their group that they identified with, they became more feeling of responsible. So again, real impacts when we create a culture where people don't feel like they belong together. We switched it then to how likely would you be to approach others for help. So again, the heterosexual women and LGBT students were pretty willing or somewhat willing to approach others for help with mental health distress. But for the heterosexual men, if they felt the university didn't support diverse students, they were pretty unlikely to actually reach out to someone for help. And if they did feel there was more support for diversity, they became pretty likely. So that was a big jump there, almost a 2-point jump. And then approaching a professor, so nobody really wants to approach a professor. The high numbers are even 2.5, but again, women and LGBTQ population was pretty resistant, but again, the men went from really not wanting to do it to, okay, I guess I'll do it. And then seeking a mental health practitioner is a similar trend. So what we're finding is that these efforts to change how we interact or relate to people on campus in terms of diversity and inclusion have probably real impacts on help seeking and help giving on campus. Okay. So pivoting to sort of wellness promotion, so how do we help students stay healthy? I sort of talked about we're seeing more students say they don't want to stay at the university because they feel like they don't belong. So creating more initiatives on campus to help them belong. One thing we're doing at Florida State is realizing we've had such a flood of students coming to the counseling center, more and more. It used to be we were trying to get more students in, and now we're overwhelmed. And so thinking about how do all these students need to come to the counseling center for help? Certainly those in crisis do. A lot of people might need a couple of sessions, but a lot of things could happen more in the community, connecting with friends and family and activities. Looking at the broader ecology, some of that are the policies that we just talked about in Florida, but also creating, kind of going back to the earlier slides, creating a sense of safety on campus and a sense of belonging. Having social connection is a prerequisite. We learned that from the living learning communities. When students feel more connected, that can help our training, since that would be something to focus on. how to make a large university feel smaller so that students aren't getting lost and that everyone feels like they belong. A lot of this is through engagement in activities and clubs and having those capabilities. At Florida State, we have in our first year courses these signature courses where we get students to engage in projects with each other. And one upcoming study that we're going to do is getting students to develop social connection projects. So instead of us telling them how to connect socially, we're going to get them to develop projects as part of this course curriculum, and we're going to be piloting this in the fall. And I know we're kind of getting a bit on time, so I might pause and shift to questions.
All right, if there's anybody who has questions from the audience, feel free to come on up.
I was going to ask, because of the legislation, have you seen students leaving the university to leave the state?
We are seeing students leave. I don't have the stats on it, but I know a number. I have in addition to being a faculty member, I have a small private practice, and a number of my students who identify as LGBTQ have left. We also are having a really hard time attracting faculty and students. We used to get probably 140 students apply to our program each year, to our doctoral program. This year we had 40. Maybe 50, but 10 of them didn't submit, their stuff. So 40 complete applicants or something like that. So I don't know that it's related to legislation, but why would you want to go to Florida if you could go somewhere more friendly, is the feeling. I don't mean to harsh on my home state. Well, this is my home state. I'm back. Yeah. So yeah, I don't know the exact number, but I know some students are leaving, and more impactful is they're not coming.
Anybody else have any questions for Dr. Swanbrow Becker? You're also welcome to form a line up here if you have questions.
Should we bring the microphone around and, do it panel style? Whenever I needed to walk, I gotta get my steps in. Hi, Doc. I had a question about the faculty trainings that you were talking about, where you do the 15-minute incremental trainings. Do you normally do a one-off type of training, or do you try to throw in, I guess I would call them like refresher sessions? Do you do anything like that?
That's a great question. They tended to be one-off. Our vision was that they would love it so much we'd come back each year.
Right.
But it's a big campus, and when we're training, one department at a time, it took a long time. So it took us the whole year really to get through it took us 3 years to get through 1,500, and we have probably 15,000 faculty members. So it's a good question, because it got us into those meetings, but it didn't, and it did train a lot, but it didn't mass train everyone. And I don't love the virtual, here's a video to watch, I don't know that they're going to watch that. Yeah, the in-person thing. So it's I think maybe one thing we could do better is having more resources, more trainers, and then try to have a commitment to come every year to follow up.
Okay. Yeah. Cool. Thank you.
Thank you.
Appreciate you.
Hi, how are you today? My question is regarding staff and faculty. Do you guys have a union for staff and faculty on your campus?
We have a union for faculty.
Okay.
I don't think we have a union for staff.
So my other question is, does faculty go to do you guys do a convocation in the fall and a colloquium in the spring?
convocation for?
So at our college, we all come together at the beginning of the year, of the college year, and there are breakout sessions. There are people who are doing presentations, and they get a chance to go to different things. There's a big president gives his college address, and then go from there. In the spring, we have colloquium, and the faculty does a lot of presentations. So the reason why I was asking, because it put an idea in my head to write down to take back to campus. Well, to get the staff and the faculty, because it's mandatory that we have to go to both, to kind of get them do the training while they're on mandatory days. So that's the reason why I was asking.
Yeah, so, and I'm glad you asked that question. So we have new faculty training in the fall where all new faculty have to come, and we do that suicide prevention for faculty training at that. So we get all new faculty there. The colleges and departments tend to have those beginning of year meetings and end of year meetings. And we do have a research symposium where we present our research in the spring, similar. That's where we did our initial trainings, and that would be the place to do follow-ups also.
Thank you.
How do you capture students who might fall outside of those previously established connection places, whether it's the first year experience or Greek life or whatever it is? How do you get the folks that aren't already there?
Great question. So one thing we did was we mandated these first year courses, so all students have to take them as part, and courses check off these sort of boxes. So that was a big step, was to mandating they have to take them, and so making sure we get the content in there. We train resident assistants to kind of look out for those students who never come out of their rooms and check in and be friendly. I think a lot of it is getting the training to the students. Here's what to look for, because that person must be talking to somebody, and so if we can get it reached out to the students enough, they might reach them. That's the problem with if the expertise is all in the counseling center, we would never see them. Thank you.
I wanted to bounce off that actually. So I agree with the point that you said that students are way more willing to talk to their peers. Do you have student volunteers at your counseling centers, like at the clinics and everything, or is it just staffed by?
Yeah, we have a group called Renew, which is, I can't remember what the acronym is exactly, but they're students, undergraduate students, who are at the counseling center, and they engage in outreach and promotion around campus. There are also counseling staff that do that, but this is a group of, I think, about 10 who reach out around campus, and they're supervised by a doctoral student from our program, who's a doctoral student in counseling psychology, and that person's supervised by a clinician. We also have our student groups, Active Minds and NAMI, on campus that weren't really connected, but we are now connecting with and collaborating with them.
Great, thank you.
Yeah.
My question is about the research and the student populations that you polled in that. I'm just wondering about the demographics of undergrad students, graduate students, PhD students. What are the percentages of those students, and who falls into this research?
The last research that I showed about that sense of support for diversity were undergraduate students, freshman through senior. Some of the others, it depends on which one it was. Usually it's undergraduates. The ones that talked about the sort of continuum of distress, how many times people thought about different ideas, that included graduate students too. Most are just undergrads though. Yeah, and I think there are different experiences for undergrads and grad students, different stressors, there are different points in their lives.
As the students come in and they have more and more complex cases, how do you work in tandem with the clinical aspect or any kind of medication? So you have counselors and there's the counseling piece, but there's also the clinical piece. And sometimes it's warranted and sometimes it's not. So I know that there's like triage issues and you don't want to solve everything with a pill, but how do you guys kind of navigate that?
Yeah, a couple thoughts. Our counseling, the structure of our health organizations on campus are all under university health. So the counseling center and the health center both report to a director. So I think structurally it's managed that way. We don't have a lot of psychiatrists on campus. We have, I think, 2 for 45,000 students. So I think a lot get help outside of the university. Some of the research that reminds me of is when we ask students, college students, when did you first start thinking about suicide? 75% said I had thought about it before I got to college. So it's not that the university is necessarily creating suicidal thoughts among people. They've been dealing with this for a long time. Many have other providers, and I think we saw that during the pandemic when students went home. They went back to their providers, and now, at least in Florida State, they're not coming back to the counseling center as fast as we thought. I think with telehealth, they went home, they got hooked back up with either their prior provider or a new provider, and they are kind of staying with that. So we've seen some shifts there. But a lot of students are on campus with medications and transitioning to college. It used to be their parents would remind them and have it stocked up for them and take care of that. Now they have to do it themselves, and it's much more risky, and they would miss it. So I think that's a big piece.
Alrighty, we have time for one last question here, then we'll wrap up.
All right, I'd like a 2-part question. It's like HAP data and then FSU specific. You showed the slide breaking down student connectivity based on socioeconomic status. For the lowest quartile, you mentioned that they have lower number of close friends. I was wondering if that data, that question, were you asking about close friends on campus or close friends as a whole?
I think we just asked how many close friends do you have.
Okay.
But they were on campus. So, yeah, I think we just asked that.
And then I have a friend who's faculty in the film school at FSU, and I know they have specifically like a film school mental health support. I'm just wondering, because that's a new idea to me in the colleges that I've been at, if that seems to be more effective, having like a college-specific person as opposed to just a general counselor, or what you found.
Yeah, it's created quite a stir on campus. The counseling center wants to maintain control of the clinical experiences on campus. In fact, they press on my clinic a lot because they don't like that I have this clinic that's running parallel to them, and am I complying with their rules and all of that. So they don't love that. We find, I don't know about the film school, but with athletics, there's a similar model we've got. So any program that wants to come in with funding can do this model where they have their own clinician. Our medical school has that, where they have, I think, 3 or 4 counselors just for the medical students, and they're located in the medical school building. Same film school might have one. Athletics has one person. And you can't get a response from her for email. Like, I've tried to talk to her about practicum students or activities, and she's so overwhelmed because there's so many students for just her that it's not really working that well. So I think that's the problem, is that if you have too many students with one person, it gets overwhelming. The good thing is you have someone focused on that population. So I think the medical school model is a little bit better. They have 3 or 4 counselors, so it's enough capacity for who's there.
Thank you.